Hello everyone, I'm urologist Omar Makaya. Today we will talk about erectile dysfunction in couples with infertility. In couples experiencing infertility, pressure from the environment, words such as, "when will you have children?" can bother the couple. If a couple still cannot have children 1 year after trying to have, we call them an infertile couple. Here, the pressure on the couple can cause stress-related problems in the male partner. Studies have even shown that this pressure can further deteriorate sperm quality. At the same time, sexuality becomes pregnancy-oriented for the couple. In other words, instead of lust and desire, the aim has been to have sexual intercourse to have a child. Having sexual intercourse at certain times and intensifying at certain times is a little contrary to the sexual cycle and nature of the man. Because the man will have sexual intercourse, after a certain time he will have desire again and have sexual intercourse again. It can be like that. Erectile dysfunction or sexual dysfunction is not at all rare in men in this period. There is a loss of sex drive in men. On the contrary, sex drive may increase in women during these periods. During these periods, men are usually young and they may hesitate to tell this complaint to both the doctor and their spouse. This is a difficult process for men. At the same time, with the increasing industrialization in the last 50 years, we also see a deterioration in both sperm quality and sex hormones due to adverse working conditions. For example, whether it is forklift users or people in the IT sector, sperm quality can be even worse due to working conditions. So what do we do? When such a couple comes, the first thing we ask is the frequency of weekly and monthly intercourse. For example, there is a difference in pregnancy rates even between having intercourse 4 times a week and having intercourse twice a week. Again, in an international study, they saw the number of intercourse 3 or 4 times in a menstrual cycle in Japanese and 8 or 9 times in Germans, and they found that the pregnancy rates were higher in Germans. When such a couple comes to us, we first evaluate this issue. We check whether there is an organic cause. If it is really an erectile dysfunction caused by stress, we start treatment with the simplest treatment, drugs such as tadalafil and sildenafil, which are PD5 inhibitors. Sildenafil is Viagra. Does Viagra harm the sperm? No, it does not. There are publications showing that it can increase sperm count and testosterone. There are publications showing that it can increase the quality of the fluid we call prostate secretion, thus contributing to pregnancy. Even in women, there are publications showing that pregnancy can be increased by increasing the thickness of the inner wall of the uterus using Viagra. Of course, this is not a treatment applied in every clinic. There are publications showing that even this can be beneficial. However, a healthy pregnancy requires a healthy egg and a healthy sperm. These will combine to form an embryo. It must be a healthy embryo and the thickness of the inner wall of the uterus is very important. Under normal conditions, this inner wall of the uterus should work in an integrated way with the egg to produce the child. On the other hand, there is also good news. Generally, after this infertility process is over, we see that problems such as sexual dysfunctions in men and premature ejaculation disappear. But always, when the problems are corrected as soon as possible, the problem is eliminated before it grows. Therefore, if you are experiencing such a problem, a condition that may be erectile dysfunction in men during infertility, you should immediately consult a specialist doctor, a urologist. Even a simple treatment, even a simple suggestion, can give you a great advantage both in your couple relationship and in having a child. Thank you for listening. Best regards.